Dr. Toups, can you tell me about your area of expertise and why it may be important for the person watching?
Well, I practice functional medicine psychiatry, and that's a general functional medicine practice, but applied to the brain. So psychiatric disorders, cognitive impairment disorders, dementia, those kind of things.
Personally, I'm seeing the prevalence of psychiatric-related issues like anxiety and depression so prevalent. I'm seeing them in my friends, I'm seeing them in my family members, and I'm seeing that it's a real struggle. I mean, depression and anxiety are really big challenges today, and the number one conventional approach appears to be, to me, that it's medication.
Right.
And what do you see as the answer, and more importantly, what do you think is the underlying cause of these problems?
Well, that's a really broad question, and of course it's multifactorial issues with psychiatric disorders, but apart from emotional issues, which of course play into every kind of disorder, most physiologic psychiatric disorders are due to problems in the body. So they don't start in the brain, they start in the body, and things get out of balance in the body. So in order to help people with their brain involvement, and really we think of it in terms of inflammation in the brain. So it's not deficiencies of neurotransmitters in the brain, which is what mostly we were taught in psychiatry in the past, but it's really conditions that are creating inflammation in the brain. So we look for sources of inflammation in the body and try to balance those, and that affects the brain. So typically we'll start with the diet. What are people eating? Because that affects the microbiome in the gut, it affects the permeability of the gut, and when the gut is inflamed, then food particles that we eat get through into the bloodstream, bacterial toxins can get through into the bloodstream, and that activates our immune system. So when the immune system is activated, it doesn't just stay right there in the bloodstream next to the gut, right? We have circulation, and we have circulation that crosses the blood-brain barrier. So when things get into our blood-brain barrier and our immune system is activated there, it just stays in this inflammatory killing mode. One of the factors that we know is a big issue in the gut is eating gluten for people. It sort of doesn't matter whether you're allergic or not. We've learned that when we eat gluten, it elevates this protein called zonulin that increases the permeability of the gut. That's called leaky gut. That's gotten to be a pretty common medical term these days. And leaky gut is what it sounds like. It's little microscopic holes in the cellular junctions. And then since gluten is what created those holes, that's the first thing that gets through and activates the immune system, because it shouldn't be in the blood. The blood should be sterile. So when that gets into the brain, the immune cells in the brain are called microglia. And when those microglia get turned on, they don't have an off switch. They just keep churning out those inflammatory chemicals until they die, which is reportedly 2 to 3 months. So I'll have some patients tell me, oh, I don't eat much gluten, once a week or once a month. And I tell them, well, you're just staying in that constantly inflamed state. And what happens when we have inflammation in the brain is, well, it affects different people in different ways, but it can affect different structures in the brain, and certainly can manifest as anxiety, depression, cognitive problems, ADHD, all of those factors.
Fascinating. And Dr. Toups, what kind of results have you seen in your patients?
From starting with an anti-inflammatory diet and working with the factors, because that's just the first step, of course, is the diet. But let me tell you that for some people, I have fantastic results with only working on the dietary issues and healing their gut. So I had a patient who came to me with a severe depression. She was crying all day. She was suicidal. And in her case, while we were doing the workup for other factors affecting that depression, I started her on a whole foods diet, eliminate the gluten, eliminate the dairy, since that's another inflammatory factor for people. And this lady came back a few weeks later, and her depression was gone. It was completely gone. Like, that's all I needed to do in her case. Well, I believe I started a few key nutrients like fish oil and vitamin D and B vitamins that are also helpful for the brain. But it was amazing. It was gone, and she was scheduled to have a surgery for her hip, and her hip inflammation went away, and she didn't need to do that. And then fast forward, so great, that was all we needed to do for her. She came back many months later and said, my depression's back, I'm crying again. And it was in January, and she said, I cheated on my diet during the holidays. And I said, well, that's a great clue. You know what to do here now, don't you? And in that case, that was just amazing, the power of food for her, and keeping her diet clean and anti-inflammatory kept her depression at bay. And as soon as she let up on that, there it was, back again. So in her case, that was certainly an area of vulnerability that could be controlled, simply with diet and nutrients.
Excellent. Can you tell me some other case studies? Have you had other people come in with dementia and you've seen some alleviation of their symptoms?
So these days I'm working a lot with cognitive impairment and dementia. I'm actually kind of shifting the focus of my practice to that because it's such an important area that we've learned that we can actually reverse mild cognitive impairment and early dementia by looking at all the various factors that are driving that. So it's never any one thing. It's not just one thing. So, with regard to the diet, of course, we start with the diet because that drives the health of the microbiome, the gut, and henceforth the brain. We talk about the gut-brain axis. So what happens in your gut drives what happens in your brain. Now with the diet with dementia, it ends up being a little different. What we're finding is that ketogenic type diets actually are very effective for people with cognitive decline. Obviously no diet works for everybody, and it's not necessarily right for everybody to be on a ketogenic diet. But with a ketogenic diet, what one does is they eliminate their carbs or keep their carb levels down below 50 grams a day. And carbs normally turn right into sugar, and our body runs on sugar. But instead of sugar, then when you deprive your body of sugar, it starts burning, generating ketones. And those ketones somehow heighten our cognitive abilities in the brain. And we've seen people 3-4 days on a straight ketogenic diet that already have improvements in their cognition. So that's a pretty exciting thing. Oftentimes we'll have people add the MCT oil, the medium chain triglyceride oil, that further enhances that ketogenic factor. And there have been many case reports in the literature of people starting to eat tablespoons of coconut oil and MCT oil and having fantastic gains in their cognition. So that's the first place. Obviously there's many factors that cause dementia, and what we've learned, I have done a lot of work with Dale Bredesen and his very important research that is bringing out to the world this notion that we can reverse dementia, and using this method, it's something that I've used for many years previously in working with dementia patients, but pretty much what I do is what Dale Bredesen has written about. And so we work with all of the factors. So we're looking at the hormone levels. We know that when we lose our hormones, our estrogen, our testosterone, our progesterone, our pregnenolone, we have receptors for all of those hormones in our brain. And so when we don't have adequate levels of those, what happens to the brain? It atrophies, it shrinks, it doesn't work. And there's pretty clear data looking at women and estrogen that the minute women start losing their estrogen, their neurons start degenerating. That research has been coming out more and more, I'd say, in the last decade. So that's pretty clear. But it's the same thing for testosterone, and both men and women have testosterone. Both men and women have estrogen. We have somewhat different levels, but we need all those hormones. They're trophic for the brain, and so they maintain the brain. And we need to have adequate cholesterol levels. So some of my patients with cognitive impairment have very low cholesterol. And cholesterol, we've been told, for decades, we need to have low cholesterol. Now we know cholesterol is not the enemy. It may be the lipid subparticles that are driving the atherosclerosis, but cholesterol, the brain is made of fat. It's like 60 to 65% fat. So if you don't have enough cholesterol, that's a healthy fat that makes our brain. And so we need that cholesterol, one, to support our brain. The myelin sheaths around the neurons, we need those lipids from the cholesterol to do that. So that becomes another factor, keeping healthy fat levels for people, and the ketogenic diet sometimes can add to that. The other factors, one of the huge factors that I really don't want to neglect mentioning is infections. And it's really surprising us in our work with the Bredesen protocol and one of my study groups with Dr. Bredesen, where we're all going over our cases and putting our heads together on this, we're finding that huge numbers of our patients are having infections that are driving some of the cognitive problems. So we're seeing just an epidemic of Lyme disease. We know that Lyme disease is a spirochete that affects the brain. It's the same kind of organism as syphilis. And we're just seeing, tremendous amounts of our dementia patients turning out positive for Lyme disease. Another factor that we see that's driving that brain inflammation is mold or mycotoxin-related illness. And we know that mycotoxins are neuroinflammatory, so they're causing all this inflammation in the brains of sensitive people. Now, with mold, not everyone is sensitive to getting sick with mold. 75% of people, if they have a big mold exposure, they may be ill, but their body will clear those toxins and they'll be fine. But about a quarter of people have a genetic sensitivity. There's an HLA genetic type that we look at for that. And those people, when they get exposed to mold, it just stays in their system and it keeps triggering and triggering the system, and it causes tremendous effects in the brain. I have young people in their 20s that have dementia. I mean, their cognition is so bad. I treat several UC Berkeley students, brilliant young people that have had to drop out of school that can't even read anymore because of the effects on their brain. And then once we remove them from the moldy environment and do various things to bind up that mold and support their immune system, their cognition will come back. So,
to what level does it come back?
It will come back. Yeah, people can get their brains back.
Meaning that they're fully functioning.
People can get their functioning back. It's a path, of course, when you get that ill, but people can definitely get their functioning back. And it's the same thing with elderly people dementing as well. So if we can intervene and find all these factors that are driving their degeneration of their brain and remove those factors, then we actually can get cognition back. And what we see we do volumetric studies in the brain, so we do special MRIs where they take extra cuts through the brain and then you can run them through a program like NeuroReader is the one that I typically use. And that report will give me the actual volumes of all of the structures in the brain and how does that volume compare to an age-matched control. So we know with Alzheimer's we often see atrophy of the hippocampus, which is where our memories are stored and formed. And so when we get these volumetric MRIs, we will see quite a bit of atrophy. When we start working with a functional medicine program to get everything in balance, we can see that reverse. And actually, I had a patient of mine that I've worked with that was here at this conference. And he started working with one functional practitioner who put him on a good starting path. And then when he heard I was working with dementia, he referred him to me to, take him up a notch. And so we've done various things. And literally, I believe his two head scans were 6 months apart. And, he had moderate atrophy on the first scan, and he had very little atrophy on the next scan. And his MoCA is a test that we use to rate a level of dementia. And the MoCA score, I don't remember what it was initially, but it was definitely in the clear Alzheimer range. And it's come up to, maybe 1 point off of the top score. And this was in a pretty short time for this gentleman who is quite a brilliant psychology professor. And he was here at the conference this week, learning about all of these neuroplasticity approaches because it's now become his area of interest because he's greatly benefited from that. So, yeah, it was quite exciting to see somebody functioning normally from where he had been before. So, yes, we definitely see people improve and get their functioning back.
He had his life back.
What's that?
He had his life back.
Yes.
Yes. And he was able to do the things that he was usually able to do.
His brain is working, he was able to, and his first doctor who has worked with him longer than me said he was just amazed to see him here at the conference. So what a testament it was, because he would not have even been able to come and negotiate, being at a conference, much less get the benefits that he did.
Wow. Some of these students from Berkeley that you're seeing, are
Yes.
they able to go back to school after they get better?
I have a couple that I'm still working with on the path, and what happens is sometimes you work with a mold and then you start discovering other factors that are affecting the immune system. So both mold and Lyme and some of the Lyme-related co-infections, they really affect and suppress the immune system, and because they're affecting the brain, they affect the whole HPA axis that drives all our hormones. So we'll find all those things out of balance. And so I would say the two of them that I'm thinking of in particular, once we worked on the mold factor, now we're working on the Lyme disease and the co-infection factors. So sometimes when the immune system improves a little bit, you'll start to then see the antibodies test positive for the Lyme disease and the co-infections.
How do you treat Lyme?
Oh, that is a loaded question that couldn't be dealt with in a short interview. There's many different approaches to treating Lyme, and the way that I start, I'd say I'm a fairly newcomer to learning about treating Lyme just the last 2 years maybe, because as I have many patients that I can help with general functional medicine psychiatry approaches, but the longer I've done it, I've come to see the impact of these infections and really how common they are and how much they drive the inflammation in the brain with all kinds of disorders. So I've just been learning. I'd say it's a huge path to learn how to treat Lyme disease, because we don't have any great controlled studies. It's been a disorder that's kind of been poo-pooed, and people think you take a month of antibiotics or 2 weeks of antibiotics and you're fine and it's gone. And now we've learned quite differently. But the first step to treating Lyme to me is to support the immune system. We know it affects the immune system, and so for some people, people are affected by different degrees to Lyme, and I've had some people that just working with their gut health, their microbiome, their immune system, their nutrients can help restore them to health. And then there's other people that it's quite entrenched. I call it Lyme in capital letters, and it's really affecting their brain, and they're quite dysfunctional. And so there's a whole gamut of using herbal antimicrobial protocols all the way up to people that seem to require prescription antibiotics long term. And when they get to that level, I feel like antibiotics are not my area of expertise, so I'll refer them to some of my Lyme literate colleagues.
Kat, I want to ask you about your personal story with what you had, which would be described as dementia. So in my case, and this is how I learned functional medicine, it's how many of the early adopters of functional medicine have come to the functional medicine table. We have illness, or someone in our family has illness, and as physicians we can clearly see that there is no clear path to treat the kind of illness that we have. In my case, I developed what's called multiple chemical sensitivity, so I got allergic to everything. My immune system was just on hyperdrive. It was reacting to everything. I was allergic to many, many kinds of foods. I couldn't walk into a grocery store because the smells of the chemicals would give me rashes and hives. I was just covered with rashes and hives. And completely with all that inflammation that was happening coming out through my skin. Of course, it was a systemic inflammation. I had severe fatigue. I could barely get out of a chair for a year. And with all that inflammation, it was eating up my brain. And so when I had stopped working, I was doing Alzheimer research. I used to run a clinical trials research center, and I've done over 100 clinical trials, and I've done 20 trials in Alzheimer's. And just as a little digression, none of those trials were successful. 20 major long-term trials. We could wipe out the amyloid plaques, but that was not what was driving the dementia. So I was doing dementia trials, and I came to realize that I was as cognitively impaired as some of my patients in the trial. I would do a test called a many mental status, where I'd give them 3 words to remember, and I'd have to write down the 3 words so that I could ask them a few minutes later, because I couldn't remember those words. And I had given that test for over 20 years, so that was quite an amazing realization. Was it discouraging
that
for you?
I had no short-term memory.
Was it discouraging for you?
Was it discouraging? Well, it's. I think I was just trying so hard to survive every day. People asked me, "Were you scared?" And every day was just such a struggle trying to function at my normal level, which of course I clearly wasn't doing at that point. I couldn't drive a car very well anymore. My husband got in the car with me one day and he said, "Kat, what's wrong with you? You're like a little old lady." And I said, "I don't know, there's so many things happening when you drive." And my processing speed was so poor that I couldn't integrate those things well. And I actually lost the ability to back up or parallel park. I could not do those things. My brain just couldn't sequence how to do that. And I was a good driver before, and I'm a good driver now, but I certainly could not do that at all. I couldn't do things on a computer that I had been doing. My poor husband, I would ask him, "Dorian, how do I do this?" And he'd say, "I just showed you that." And I wouldn't even remember that he just showed me. I could barely dial a phone number. I would get confused sometimes and have to start over 2 or 3 times. And so I started learning functional medicine.
Where would you be right now if you hadn't done something?
I would be drooling in a nursing home by now if I had not done all that I had done to reverse that inflammation and that cognitive decline. So,
and what does it feel like for you to look at that picture of you in that old folks home drooling?
Well, it's not a visualization you really want to have, but I think it's just the perspective that we don't have to have people drooling in a nursing home. We have the tools now to look at all of these factors that are affecting their cognitive decline and put them back in balance and stop all the holes in the leaking roof, as Dr. Bredesen says. And nobody should suffer that way anymore. I was in my early 50s when I got ill, and I've worked with people diagnosed with Alzheimer's in their early 50s, and it's a different critter. It goes very fast. People in their early 50s, when they have cognitive decline, typically with Alzheimer's, we say, okay, it's going to be a 10-year process and your brain will degenerate and, eventually stop functioning. But when it affects younger people, it goes fast. And of course, now as we're starting to look at all these factors that are causing and perpetuating the dementia and driving it, what we're seeing more and more in some of the younger people is the CIRS, or the chronic inflammatory response syndrome from Lyme and mold and those kind of factors. So it's really, it's so exciting, that we can find these treatment targets. Now, toxins are another thing that drives, neuroinflammation and degeneration. So now we have commercially available tests that we can use to look at levels of toxic chemicals. We can look at levels of heavy metals. All of those things cause neurodegeneration. So those all become, part of what we're looking at.
How do you get better, Kat?
How did I get better? Little by little, I went through all the modules through the Institute for Functional Medicine, and I first went to a conference called Food is Medicine, and that opened my eyes. It changed my life. It changed my practice. It changed my life. To understand how food has the power to turn on and off our genes, affect our microbiome, and affect everything in our health. So, I ate a relatively healthy diet, but it was definitely an eye-opener with that. And
some things were inflammatory for you, though, weren't they?
Well, at the point for me, I had become sensitive to everything. So many foods. I went on a diet that eliminated gluten, dairy, eggs, soy, nuts, seafood, later legumes, later nightshades. I was reacting to pretty much everything. But what happens when you're in that state is it's that your gut is so leaky that every single thing you eat is getting through those microscopic holes in your gut and activating your immune system. So in that case, the real key becomes heal your gut. Do everything you can to, heal that leaky gut so that all of that stuff is not chronically activating your immune system. And that, of course, is a process. And when you're as sick as I was, it was not a fast process. I would say, it took me 8 months of that very restricted diet to start to make some headway with the rashes and hives that were all over me. And my patients will say, "How could you stay on that diet for so long?" And I tell them I had no other option. There was no options. I could take steroids. They would suppress my immune system, but that I knew enough that wasn't going to be the answer to heal anything. And we know that when somebody is really allergic to gluten, which I certainly was, there's these little villi that line the gut. And they're like little finger-like projections, and they help they absorb our nutrients from our food. And when you actually have a gluten allergy, those things get chopped off and blunted. And it takes about 8 months for those villi to regrow when you stop your gluten for somebody that's gluten sensitive. And it's interesting, I learned that after the fact. And when I thought about my timeline, I thought, oh, about 8 months on that diet is when I started to make some headway. So we'll see when we eliminate things for some people in their diet, like my patient with severe depression. She just eliminated gluten and dairy, and in 4 to 6 weeks she was a new woman. Some people, we see that, it's fantastic. Other people are very, very sick. Their gut is very, inflamed and leaky, and it may take a long time, but I think it's really important to empower people to stay that course, because it will give you results if you keep going and work on all those factors.
Kat, you experienced dementia. And you had lost all this cognitive function, and you said that you'd be drooling in an old person's home, a nursing home, if you hadn't have done what you had done.
Yeah.
Where are you today? Are you? What's your mind like? What are you able to do? What's your daily life look like?
Oh, my daily life is, a whirl of neuroplasticity. I'm constantly researching things every single day, trying to learn all these factors to help people. There was a clear time when I felt like my brain came back online, and that's how I thought of it. My brain was offline, and suddenly it was online again. And I remember saying to my husband, wow, I can hold the phone number in my head and dial the phone number. And my husband, who's had ADHD all his life, said, well, I could never do that. And I go, yeah, but I could always do that, and now I can do it again. So, it was, of course, a gradual process, but there seemed to be a clear shift of a time that my brain did come back and start to work. And
you see patients?
Do I see patients?
Yeah.
Oh, yeah. Yes, I've been doing a functional medicine practice, I would say, for the last 4+ years at this point.
And how long are some of your consultations with your patients?
Have you heard about my consultations with my patients? I would say my initial consultations run about 4 hours. That seems like the harder I try to make them shorter, the longer they get. But what I've found is if I can spend an afternoon with a patient and understand all of those factors that are driving them, and have them understand and believe in the power of why they should work with a functional medicine method, we can move really quickly. So, it's something that I could see them for 1 or 2 hours over a couple of months, but if I look at the whole picture, and some of these patients are so complicated, there's so many things to look at, that it really does seem to take that long for me to do it right, to look at all the factors. I always say we have to look under every stone, turn over every stone. Do you have this? Do you have that? And and then test all of those things. So testing is another very important part of a functional medicine approach. As functional medicine physicians, we've been criticized about how much testing we do, but so many of these problems you cannot find out that they're a problem until you test them.
You just don't really sound like someone to me that has dementia.
No, I don't have dementia. But I did definitely have dementia. And dementia, it's a broad term, right? It's cognitive decline, your brain is degenerating. And mine certainly was, in 2009 when I stopped working, it certainly was.
1 in 3 seniors die of Alzheimer's or dementia, right? 1 in 3.
Maybe even 1 in 2. Over 85, it's 1 in 2, and it's expected to be even a higher incidence than that if we keep on the current trajectory. I mean, we're getting what? Well, we're having more and more toxins in our world. All of our, much of our food is sprayed with Roundup, which seems to have neurotoxic and carcinogenic effects. And there's so many chemicals. We slather our bodies with things with fragrance and parabens that are endocrine disruptors. And it's just such a sorry state that our babies are born with, over 200 chemicals in their blood already from whatever the mother has used, ingested, or been exposed to. And these are young women, so 20s, 30s, and the babies are born with all these chemicals. So that certainly is one of the factors that's driving, I suspect, this high incidence of Alzheimer's.